The contents of this video are for informational purposes only and are not meant to be considered as medical advice. If you have any concerns about your health, please have a conversation with your healthcare provider. Thank you, and I hope you enjoy the video. Hello everyone, my name is Brian Wiederhold, and I'm a physician assistant student at South University in West Palm Beach, Florida. I'm making this video as a part of the capstone project for our program, which aims to educate the public about health issues that affect our community. I have worked hard on this project alongside my capstone advisor, Professor Tammy Gaines, so I thank you for tuning in. To start off the video, I'd like to just let you all know a little bit more about myself. I was born and raised in southern Maine and did my undergraduate education at Boston University in Boston, Massachusetts. I moved to South Florida in 2018 and I've been loving it here ever since. I started at South University in 2021 and I'm thrilled to be working my way towards the finish line for my graduate degree so I can get out there and help the people in my community. With all that being said, I'd also like to just start out by clarifying what a physician assistant is for anyone watching who may not be aware. A physician assistant, or a PA for short, is a licensed medical professional who works as a part of the healthcare team under the supervision of physicians. PAs can evaluate and diagnose medical conditions, prescribe medications and imaging orders, perform procedures, assist in surgery, and so much more. The goal of the PA profession as a whole is to make care more available via strength in numbers, as we work with physicians, nurse practitioners, and other clinical staff to help our patients. As a future physician assistant, I know that I have a duty to care about the long-term health of my patients. For that reason, it's important to talk a little bit about the Healthy People 2030 initiative. Healthy People 2030 is basically what it sounds like. It's a list of health and wellness-related goals that are published on health.gov. The purpose of these goals are to identify the health issues that most significantly affect American citizens and track how well or not well the data suggests that we as a population are improving in these issues. Where the 2030 part comes in is that we have the initiative setting up goals for improvement that we hope to meet by the year 2030. For each health issue, we can also see whether the data suggests that the issue is getting worse, if it's getting better, or if it's just been staying the same over the years. It's an amazing resource, and it helps us to understand how the health of our population as a whole is changing over time, and new goals are put in place every decade depending on how things change. Out of the many topics available in the Healthy People 2030 database, I chose to research about preventing fall-related deaths among older adults. Of the Healthy People 2030 goals that pertain to the older adult population, the goal to reduce fall-related deaths is the only one that is still getting worse with time. I chose to research about falls and the problems that can result from them largely due to the large elderly population that exists in South Florida, where I plan to practice medicine after graduating. Florida has higher rates of fall-related injury and death when compared to the U.S. average, so our communities need to focus more on how to protect our elderly populations the best that we can. My goals through this project are to educate individuals of all ages about how to prevent fall injuries and discover how I can make a difference as a future healthcare provider for individuals who are at risk for falling. With all that being said, let's get into the finer details about how we can reduce fall injuries. Even though we all know more or less what a fall is, the term actually does have a specific medical definition. Under this definition, a fall is an event that results in a person coming to rest on the ground or other lower level unintentionally, which is not a result of a major intrinsic bodily event or an overwhelming environmental hazard, meaning it's not caused by anything within your own body or anything in your environment. This is a pretty broad definition, but it encompasses what we think of in our heads when we think of someone falling or just going to the ground. We obviously know that any individual of any age can suffer from a fall, from little children to our oldest adults. However, falls affect people of different ages very differently in terms of what happens after the fall. Using data from the CDC website, we can compare how impactful falls are for individuals of different age ranges over the same period of time. From 1999 to 2020, the crude death rate related to falls for people less than 65 was approximately 1.66 deaths per 100,000 people in that age range. In comparison, the crude death rate for people that were 65 and older during that same time period was approximately 51.53 deaths per 100,000 people. The difference between 51.53 and 1.66 just shows how big of a difference it makes depending on your age. These statistics suggest that older adults consistently have more severe consequences resulting from falls, as shown in the fact that they are dying more often from the falls. Given that South Florida is known to have a large elderly population, it's also worth taking a look to see how the data here compares to the data in the entire United States as a whole. Using data published by the Florida Department of Health, we can directly compare the rates of death stemming from falls in any specific county against the rate of the U.S. population as a whole as well. Let's go ahead and take a look at the data for Palm Beach County, where South University is located. From 2015 to 2020, the crude death rate from unintentional falls in individuals 65 years and older within Palm Beach County was 63.1 per 100,000 persons, which was slightly higher than the 62.19 per 100,000 persons rate for the United States as a whole in that same time period and in the same age range of 65 and older. While this difference is modest, it's not too much, it does highlight the fact that Palm Beach County has been keeping pace with the overall increase in deaths related to falls that we've been seeing in the United States for the past few decades. Let's go ahead and take a look at a graph that shows the increase in such deaths since 2001. While the death rate has jumped up and down a little bit from year to year in Palm Beach County, the overall trend matches what has been seen in Florida and in the nation as a whole. The numbers are simply going up. Tracking statistics such as these is a critical component of the Healthy People 2030 initiative, as it gives our public health officials an idea of how the objectives are trending over time. In this case, it seems we still have a lot of room for improvement. The obvious question to address in this case is, why are falls so much more deadly for elderly people? What is the difference between an elderly person and someone who's younger in terms of falls? Let's discuss some of the possible reasons why. One main reason why fatal falls are increasingly common in older adults is simply the fact that they fall more often than younger people. To get to the bottom of this issue, we must understand certain risk factors that contribute to the increased risk of falling. There are many factors that go into any fall, and they can be very different for any given person. Some factors have to do with a person's overall health, while other factors can include objects in the home or even a person's daily habits or their daily activity level. Let's start by diving into how medical conditions contribute to deadly falls. Each of these topics is complex and honestly could be their own detailed presentations, so I'm going to try to summarize the main points about each topic and how they contribute to falls. Osteoporosis is a medical condition that plays a large role in causing the broken bones that can occur during a fall. To put it simply, osteoporosis is a chronic medical condition in which the bones become less dense, and that makes them more fragile and more likely to break during a fall. Many factors contribute to the development of osteoporosis, but the main ones are advancing age and the loss of estrogen that occurs as a woman enters menopause. Osteoporosis occurs when bone material is broken down faster than it gets built back up, meaning that the bones become less strong than they once were. As you can imagine, this means that a fall to the floor has a much higher chance of causing a broken bone in a person who has osteoporosis. Since osteoporosis is a disorder that's almost only seen in older adults, these older adults are therefore that much more likely to suffer a broken bone when they do have a fall. Low levels of vitamin D have also been found to contribute to the risk for having a bad outcome after a fall. Vitamin D is required primarily to absorb calcium from the foods that we eat, and this calcium is what forms the building block of your bones to keep them strong. In a similar way as osteoporosis, having low levels of vitamin D also leads to fragile bones that then are more likely to fracture during a fall. On the bright side, vitamin D is very easy to supplement through multivitamins that you can take daily. Also, healthcare providers often check for low vitamin D levels, as it's a very common problem for people to have. Research has also shown that poor nutrition is associated with an increase in having a fall. Healthcare providers use the Aspen criteria in order to diagnose malnutrition. Some of the main risk factors include a low energy intake, meaning not having enough calories, weight loss, loss of muscle mass, loss of fat, fluid accumulation in the body, and also decreased strength. These factors are more likely to be found in elderly people due to a decrease in appetite and a natural loss of muscle mass that happens with age. The biggest factors are decreased muscle mass and strength, which means the muscles in the legs become less powerful and less capable of maintaining balance while walking around. Since balance and stability is a major key to avoiding falls, this deterioration makes falls much more likely to happen as a person gets older. Issues with vision also contributes to falls, which makes a lot of sense. If you can't see a hazard in your environment, you're more likely to trip and fall over them. A few examples of disorders that can lead to vision problems in the elderly are glaucoma, cataracts, and presbyopia, which simply refers to worsening vision that occurs naturally as you get older. Since vision changes often occur gradually over a long period of time, it's not always obvious that the vision is getting worse. People may simply notice small changes over short periods of time, but the overall effect is a major loss of vision. There are also changes with how we walk as we get older. Past the age of 60, the speed of walking, as well as the stability when we stride while walking, become increasingly impaired, leading to an inevitable decline in the ability to remain stable while walking even short distances. Naturally, these changes increase the risk for falling as we get older. Recent research has shown that these changes are even greater in people who take 4 or more medications, suggesting that having multiple medical problems leads to an even greater instability and an even greater fall risk. We will talk more about specific types of medications that are high risk in just a moment. Another factor that affects the ability to walk involves the large joints themselves, such as the knees, the hips, and the feet joints. Arthritis is a broad term that describes problems with the function of these joints due to a variety of causes. Research has shown that people who suffer from different types of arthritis are more likely to also suffer from falls than those people who do not have arthritis. This effect is especially true when the joints of the legs are affected, as the pain and difficulty involved in moving one's hips, knees, ankles, and feet can lead to trouble when trying to walk normally. These changes over time contribute to instability and a higher chance of having a fall in a situation when a completely healthy person would not have that fall. One last medical problem that I'd like to talk about that can contribute to falls is urinary incontinence. Simply put, incontinence just means difficulty controlling the ability to urinate in a normal way. While there are several types of urinary incontinence, the main way in which this problem leads to falls is usually due to a sudden urge to urinate that causes a panic rush to use the bathroom. Research has found that regardless of age, having urinary incontinence makes a person much more likely to fall when compared to a similar person without urinary incontinence. The inability to control urination is also a medical condition that is often not addressed with healthcare providers, as people may feel too embarrassed to admit that these changes are occurring. This is unfortunate because there are treatment options available that provide a great deal of relief that the symptoms that these people have and also will help to reduce the risk of falls. Alright, so now we've covered a handful of medical conditions that have been identified through decades of research as having a large influence on increasing the risk for falling. I'll now shift the focus to different types of medications that also increase the risk for falling. Keep in mind that some of these medications may be unrelated to the medical conditions that we just finished talking about. Medications are often a necessary part of managing medical conditions that people may suffer from. However, as any good healthcare provider would tell you, medications come with both risks and benefits. The risks associated with different medications depend largely on how they work within the body, and this can mean that there can be a wide variety of side effects depending on the drug and the person taking the medication. With respect to fall risk, certain medications have been identified that increase the risk of falling due to their side effects that they have. Let's talk a little bit more about some of the more common medications that increase risk of falling. Okay, so on the screen now, I'm showing a handout that the CDC recommends your pharmacist use in order to identify medication classes that increase the risk for falling. Let's go over them quickly together. Pay attention to see if you take any of these medications as we go through them. We'll include both the brand names and the generic names for these medications. Some commonly used anticonvulsants include Lamictal, Depakote, and Dilantin. Some commonly used antidepressants include Zoloft, Prozac, Celexa, and Lexapro. Some commonly used blood pressure medications include Norvasc, lisinopril, hydrochlorothiazide, and metoprolol. Some of the commonly used antipsychotics include Seroquel, Zyprexa, Abilify, and Clozaril. Two of the more common antispasmodic medications include Flexeril and Norflex. Commonly used benzodiazepines include Xanax, Valium, and Klonopin. Some commonly used opioids include morphine, Oxycontin, and Vicodin. Two of the more commonly prescribed sedatives include Ambien and Lunesta. And last but not least, two commonly used tricyclic antidepressants are Elavil and Norpramin. Even if you don't take any of the medications from the previous list, it's still important to consider just the impact of taking many medications. This is a concept that healthcare professionals refer to as polypharmacy, which simply means taking many medications. Research has shown that taking 6 or more medications on a consistent basis puts people at an increased risk for suffering from a fall, regardless of whether or not any of these medications is considered to be high risk. While 6 medications may sound like a large number to take on a daily basis for a lot of people, as you get older, healthcare problems can arise more frequently. As well, you can have more visits to your primary care provider or specialist, leading to more prescriptions and more medication use. In reality, it's hard as an individual or a family member of a loved one to understand all the different interactions and side effects that medications can have, especially when a person is taking multiple medications daily. For this reason, the CDC has highlighted community pharmacists as a key resource for helping our patients to understand the medications they take and to identify the medications that put them at risk for falling. This is a key point that I want to emphasize, as I believe that many people do not understand the full extent of the help that their local pharmacist can provide for them. Please reach out to your local pharmacist with any questions you may have, especially if you feel like you cannot get the answers you're looking for from your primary care provider. Okay, so at this point, we've talked a lot about things that go on inside of the body that contribute to falls. Well, what about the outside? There are also many factors on the outside environment that play a big role as well. Let's go ahead and cover that next. When we talk about the influences of the environment on the risk for falling, we should think about the environment in two separate categories: within the home and outside of the home. Research has shown that the majority of elderly adults who fall do fall within their own home. This is important to recognize, and it makes sense as people tend to spend more time inside their home rather than being out and about. The important thing to consider now is, how do we reduce this risk? What things can we do in our homes in order to make it less likely that we'll fall? Research has identified the bedroom, the bathroom, and staircases as the areas within the home in which falls most commonly occur. Let's take a look at some specific things to look out for in these areas.
Alright, so we're just going to talk about some fall risks inside of the home. Carpets such as these are a big fall risk because you're able to slip on them and not have anything around you to catch your balance. Also, clutter is a huge risk factor. Just look at all this stuff on the floor. You could imagine that it'd be easy to fall and trip over any of this. A high bed is also a major risk factor, just as far as getting in and out of bed, especially if you're waking up during the night. These stairs are another great example. They're very steep and have high steps, making it easy to trip either going up or going down. Another common place to fall is in the tub, especially when getting in or out of a tub that has a high wall on the side like this one does. And then lastly, wet floors are always a major concern for having a fall, because it's easy to slip and often you don't notice in time.
We must also try to understand why falls occur outside of the home. As people get older, it's very common for healthcare providers to suggest walking as a form of getting exercise. However, walking outside can put one at a higher risk for suffering from a fall. Why don't we explore that a little bit more? The main point that I want to address is that there is a very big difference between walking for recreation and walking out of necessity. The main difference is that people who walk recreationally have much more choice about when and where they want to walk, whereas people who have to walk in order to work, buy groceries, or do any other tasks have less choice about where and when they can walk. Research has shown that people who have poorer financial situations are more likely to have to do this kind of walking to complete their tasks, likely due to trouble affording costs that come along with driving a car. This type of walking is also much more common in cities rather than in the suburbs or in rural areas, as it's harder to own a car in a city and businesses are often closer to where people are living. You may be asking yourself, well, what's the difference anyway? Walking is walking regardless of where you're doing it, right? From what researchers have discovered, it appears that people who walk out of necessity rather than their own leisure are more likely to suffer a fall as a result of walking. This could be due to many different reasons. One of the main reasons involves the presence of more tripping hazards, such as curbs and sidewalks, cracks or imperfections in the walkways, or concrete parking blocks that are scattered throughout the ground of many parking lots. Let's take a look at an example of one of those here.
Here's an example of those concrete parking blocks that you can often find out in the parking lots of shopping centers. They may seem like no big deal at first glance, however, one small trip over them can cause a big fall that can lead to big problems.
Also, there is a natural danger that comes with walking in areas where cars travel at high speeds more frequently. While we as healthcare providers do want our patients to be staying active, of course, it's important for everyone to understand the risks and societal or economic factors that influence the dangers with how people walk and where they walk.
So you can see an example of kind of what we were talking about just a minute ago in this intersection. You can see that it's a big, wide intersection with cars moving through at a fast speed, and there are crosswalks that you can use to get across, however, they are a pretty long distance. It's obvious that walking in an area such as this out of necessity is going to be less safe than walking on the sidewalk in a safe neighborhood with much less activity.
With all of this knowledge about the risk for falls and what to look for, it should be no surprise that there are tools available to screen for increased fall risk. Some, such as the FRAC screening tool, are more clinically based, and that's really better left for your healthcare provider to complete during your annual wellness visit. Others, such as the Timed Up and Go test, are easily performed at home. The Timed Up and Go test is a tool that is simple for anyone to do and should be taught to everyone in their 60s as they get into older age. This way, the test results can be tracked over the years to see if the risk for fall is increasing as you get older. Okay, so I know I've been throwing a lot of information at you at this point. Why don't we go ahead and take a break from the information overload? And what we're going to do is I'm going to go ahead and explain and demonstrate the Timed Up and Go test for all of you at home. To start, I'm going to go ahead and put the instructions up on the screen that the CDC has published so that we can go over them together. Please feel free to pause the video at any time if you feel like you need a moment to read the instructions further.
All you're going to need to do the Timed Up and Go test is a chair, a stopwatch of some kind, and shoes or walking aids as you would normally use them. To get set up, a marker should be placed 10 feet away from a chair. We'll see why in a second. You'll start off seated in the chair. Right after starting the timer, you'll stand up from the chair and walk to the marked spot on the floor. Without stopping, turn around and walk back to the chair to sit down, at which point you stop the timer. Seems pretty simple, right? Just remember to walk at your normal pace. No rushing allowed. If you are timing the test for a loved one or a friend, try to observe for things that look different from a normal way of walking. This could include a very slow pace, loss of balance, short strides, or any other characteristics listed on the right side of the handout. Okay, so here we're just demonstrating the Timed Up and Go test. You can see how everything is a nice controlled movement, nice pace, take your time and walk as you normally do. Everything here is about safety first and foremost. From this angle, you can see how we've marked our spot 10 feet in front of us. We're just going to go ahead and walk up to the marker, turn around, walk back, and then we'll sit down in a nice controlled fashion. In this last clip, I just want to once again emphasize that it's important to look at the person's arms and legs while they're doing the test, just to see how they're walking, if it's normal or if there's anything that looks abnormal.
The Timed Up and Go test is meant to see how a person walks around, which is very important when thinking about falls. Balance is also a very important factor. The 4-stage balance test is another test that can be done at home that is more geared towards identifying issues with balance. While I won't go as in-depth about this test, I'm going to go ahead and leave the CDC handout link for the test that you can all check out on your own time. This is another great test to perform at home that requires little time and very little equipment to do. Okay, so far we've talked about the risk factors for falls, and then we've also talked about how to better identify people who are at risk for falls. But the question remains, why are falls actually leading to deaths? Is it the actual fall itself? Is it what happens after the fall? Really, it's important now to discuss the impact of falls and what really happens. By this point, we know that falls can cause injuries such as fractures of the hip and the spine. These injuries are often what lead to people being put in the hospital or having a surgery done. However, the effects of the fall do not stop just once the bone is healed up and the patient is given clearance to leave the hospital. For many people who fall and have to go to the hospital or have a surgery to fix the fracture, it can become harder to move around like they once used to. This can become a big problem for many different reasons. Mainly, the lack of mobility has effects on the body as a whole. Let's quickly discuss some of the main complications that can arise when you aren't able to move around enough. Breakdown of the skin can occur, leading to ulcers from constant pressure on the skin. These wounds can also become infected with bacteria. Blood clots can form in veins, which can then get stuck in the lungs, making it harder to breathe as well. Infections can also form in the lungs, and this we call pneumonia. This is important to recognize, as these complications are more likely to lead to death as you get older. So even if the fall itself is not deadly, oftentimes the lack of mobility can occur in all these different complications that are directly linked to the ultimate cause of death. It's important to recognize that there's also a very significant mental and emotional toll that may arise after a fall. Oftentimes, this includes the fear of falling again, leading to changes in how people choose their social and physical activities. One study interviewed elderly people after a fall to understand their emotions about the situation. One participant stated, "I still feel uncomfortable when walking outside. I used to do that. I haven't reached a point where I'm comfortable because of my fall." This is an example of the type of fear that can occur inside someone's head after a fall. It seems like it would be very natural to have some fear such as this after a fall, especially if you have injuries that require hospitalization or a surgery. Once these restrictions occur, it's also possible to fear being judged or to feel isolated from your friends and family. These negative emotions can have a very big impact on how happy people are in their day-to-day lives, and this carries just as much importance as your physical health does. Older adults who suffer fall injuries are also more likely to lose some of their independence, or being able to perform what we call activities of daily living. These include bathing, using the restroom, dressing oneself, and eating, among many other activities. While these may seem like trivial tasks for those of you who still maintain your independence on a daily basis, it's important to realize that falls come with big damage, and the injuries that occur can make it hard to do these things. Losing this independence can also negatively impact a person's mental health as a matter of personal pride. What I mean by this is you become accustomed to your own way of life, and then this is quickly taken away from you as you rely on others to do the things that you used to do by yourself on a daily basis. Okay, so now we know a lot about why falls are important risks to the health of older adults. Let's now turn our attention to the things that we can actually do to reduce the risk of suffering from a fall. It's important to note that some people who are at risk for a fall may not know it or may be in denial about their risk. For this reason, the CDC recommends that older adults, as well as their family members and caretakers, become active participants in developing a fall prevention plan with their healthcare provider. Once the discussion is started, actions such as those we are about to discuss can be brought into the picture. It's all about accepting the risk and doing our best to limit the risk moving forward. Research has suggested that the single most impactful way to reduce the number of falls is to address hazards that are present within the home. The National Osteoporosis Foundation has published a guide of 25 recommendations that teach us how to make our homes safer against falls. You can click on the link showing on the screen right now to find that document. The CDC has published similar information in the form of a checklist that you can use to work your way through your home by checking off the box once each area of your home is safe. Once again, you can click the link showing on the screen right now in order to look at the checklist for yourself. Another option is to go ahead and let a professional handle the situation. Occupational therapists are licensed professionals who conduct evaluations of the home looking for the hazards that we previously discussed. Occupational therapists will recommend changes and help you to understand how to be safer in your own home. We spend so much time in our homes that these simple changes can offer so much protection against falls. Another simple step that can be taken to reduce your risk of falling is to have your healthcare provider or your local pharmacist review your list of medications with you. These individuals are trained to understand the risks of different medications and how they may indirectly increase the risk of falling down. Information about medications can be extremely confusing, and so for that reason, it's best to involve your trusted healthcare professional as part of your fall prevention program to guide your medication choices as you advance in age. A huge part of avoiding falls is simply maintaining an active lifestyle as you start to get older. One simple exercise that is recommended by the CDC is the chair rise exercise, which can be done easily inside one's home. The purpose of this exercise is to strengthen the muscles in your thighs and buttocks, which make you more stable and less likely to fall. All you need is a sturdy chair and a pair of shoes. I'd like to take a moment now to demonstrate how to do this exercise for you all. To do the chair rise exercise, you'll start off sitting towards the front of a chair with your legs uncrossed. Your knees should be bent with your feet flat on the floor and your legs shoulder width apart. Rest your hands lightly on either side of you and make sure to keep your back straight with your chest forward. Take a deep breath and then slowly stand up. Try to use your hands as little as possible while you stand. Once you're standing, take a nice full breath in and out, and then breathe in slowly as you sit back down on the chair. Try not to collapse on the chair, but rather have a nice and controlled descent. The goal is to do this 10 to 15 times as one set, rest for a full minute, and then do a second set of 10 to 15 stands. If this number is too much at the beginning, just do as many as you feel you can. If you feel weak or unstable at any time, please stop the exercise. Okay, so here's just a quick demonstration of the chair rise exercise. Remember to go ahead and use your legs first and foremost to bring yourself up and to bring yourself back down into the chair. Remember to breathe when you're going up, take a nice deep breath in and out at the top, and then breathe again as you're coming down. Do your best to remain under control throughout the duration of the exercise. Another option for those looking for group activities is Tai Chi. Tai Chi classes are specifically designed to prevent falls by enhancing lower body strength as well as balance. Research suggests that participation in these types of classes reduces the rate at which people suffer from falls when compared to people who do nothing at all. Okay, so Tai Chi sounds like a pretty great idea, right? But where do I even find a class like that? Do they offer that in my area? It sounds kind of specialized, doesn't it? Well, here's the good news, is that they really are out there. For example, where I live in Palm Beach County, the Area Agency on Aging offers Tai Chi and other balance exercise courses, which are easily accessible by signing up online or in their office. Since the beginning of the COVID-19 pandemic, they have also started offering these courses virtually, which makes them more accessible than ever before. I will leave the link for their sign-up page here on the screen. If you are not from Palm Beach County, you can go ahead and search on Google for similar organizations in your area to see if they're offering any courses for you. The future also offers promising advances with new technology. For example, one recent research study has used an intelligent video monitoring system to see if it could recognize falls within a home environment. This kind of technology is something we are already getting used to, as I'm sure many of you are familiar with doorbell cameras and in-house security systems. In this research study, the researchers found that the video monitoring system was 95 to even 100% effective at identifying true falls compared to people faking falls. While this technology is still under development and needs a lot more testing, these results are a promising sign that such technology could be helpful in the future. While technology such as Life Alert already exists, having video monitoring would be even better because it does not require the user to do anything in order to get the help they need if they fall. While everything we've covered is important information for us to consider, the main thing that I want anybody watching this video to take with them moving forward is simply an increased awareness about the dangers of falls. When we are younger, we don't even really consider the possibility. We may see our parents, grandparents, neighbors, or really any elderly person showing some of the risk factors that we discussed in this video and think of it as a normal part of getting old. To reduce the amount of falls happening, and from there, the amount of deaths that are related to these falls, we need to do a much better job of identifying those who are at risk, and then teaching them about the resources that are available so that we can keep them as healthy as possible. As it stands now, many are either blind to the possibility of a fall, or they lack the knowledge about what can be done when people are at risk for a fall. I'm calling on everybody watching this video to please be an advocate for those that you love in your life. If you've made it this far in the video, I'd like to thank you for spending the time to watch. I hope it offered you something that will help you and your loved ones live a much longer and happier life. Take care and be well.